welcoming Lizzie.
If I were to ask you to think of a medical or health condition, what would be the first to come to mind? Is it a type of cancer, such as leukemia or breast cancer? Are you thinking of a disease such as Alzheimer's or heart disease, an infection like pneumonia, or an autoimmune disease such as type 1 diabetes? Each of the conditions previously mentioned is an acquired condition, meaning a person develops it over time. Many people's minds often think of acquired conditions as opposed to congenital, or those that a person is born with. And yet, according to the Centers for Disease Control and Prevention, in the United States, 1 in 33 infants is born with a congenital disease and is the leading cause of death amongst infants. Along with congenital diseases often being overlooked comes their impact on a patient, not just physically, but furthermore emotionally. Their impact on patients' mental health consistently fails to receive the proper attention it deserves. Hello, my name is Lizzie Cameron, and I'm a junior at Holland Hall. My goal today is to show you the unseen side of congenital disease on patients and their families' mental health. Congenital diseases can be a result of genetic mutation errors, infections, issues arising during pregnancy, or inadequate prenatal care. The list of challenges patients with congenital diseases face extends far beyond just their physical health. The University of California, San Francisco, completed a study in 2013 where they attempted to identify how genetic disorders affected patients' mental health. Scientists began by noting how the DACT1 gene becomes non-functional in some patients with congenital diseases. For further information on how the brain is affected by the absence of the DACT1 gene, scientists deleted the gene from mice. They found that the structure of the nerve changed and that there were fewer dendrites. Further, they found that although they assembled into the correct formation, their function was slightly different due to having fewer synapses. Their function altered in ways found to be similar to those with psychiatric conditions such as bipolar disorder, schizophrenia, and autism. The results from that study indicated that those born with hereditary congenital diseases may also have minor neurological changes which can affect their mental health and may even result in a psychiatric condition. Depression and anxiety remain common amongst those with congenital diseases. I myself was born with a rare congenital disease called blue rubber Bleb Nevus syndrome. While growing up, I was in and out of hospitals across the nation having surgeries and procedures done to fix my health. Throughout this seemingly endless cycle, I developed an immense amount of stress. The thought of not knowing what was to come next left me feeling uneasy and extremely anxious. While in middle school, I could never quite understand why I constantly wanted to be with people and couldn't bear being alone. It reached a point where I was in an extremely dark place mentally and started attending therapy. One of the first things my therapist asked me was, were there any traumatic experiences you had as a child? By natural instinct, I told her no, because there was no major event I could think of that I thought affected me so severely. The more sessions I attended with my therapist, the more she was able to pick away at my childhood, realizing that it wasn't one event, but rather a collection of experiences, doctor's visits, and surgeries that had left me feeling anxious about losing the people around me because I was constantly removed from them from something I was unable to control. Congenital diseases, unlike those that are acquired, can begin affecting a person from the moment they are born and may not stop until their passing. Because of this, experiences that can happen as early as one's childhood may leave a lasting impact and affect a person for the duration of their life. They don't always have a simple fix, or there may not be an easy way out, and their effects are not always visible as seen in me. Many times, people born with congenital diseases experience bullying or stigma toward them due to their condition. 3 studies were done at the University of Columbia to indicate the effects of others' actions towards those with congenital diseases. In the first study, researchers measured the average physical distance people preferred to keep from those with both acquired and congenital conditions. The results showed that participants consistently preferred to remain further away from those with congenital diseases, with higher average distance scores across all conditions tested. In the second study, researchers examined both people's preferred physical distance as well as stereotypes or beliefs they had about those with the same conditions, acquired and congenital. Higher numbers correlated to greater stereotypes to that particular group. While evaluating the mean scores for each of the conditions tested, the scores were higher amongst all the congenital diseases, implying greater stereotypes and stronger stigma towards those with congenital diseases. In the third study, researchers created a story about a woman named Amy. In one instance, they created her to be born with a congenital disease that caused her to be paralyzed from the waist down, while in the other, she acquired the condition over time. Researchers found that those reading had greater stigma toward the story of Amy, where she was born being paralyzed. Stigma toward those with congenital diseases was present across all three studies. Actions such as maintaining physical distance or making assumptions, whether intentional or not, can deeply impact the mental health of an individual with a congenital disease. Living with congenital disease often comes with challenges related to body image or self-perception. Congenital diseases such as congenital adrenal hyperplasia have been found to impact one's quality of life and body image negatively. Ever since I was little, I always knew there was something different about me. While growing up, I thought it was cool to have blue dots on my body because nobody else had them. I used to pretend that the blue rubber bleb on my wrist was a watch, and I would check the time on it. As I've gotten older, people have mistaken them for bugs and tried to shoo them away. I've been told they would hate if they had blue dots on their body and that they look weird. Although I do not blame any person who has said any one of these things to me, because many times people don't understand my condition or what my blue rubber blebs are, my image of myself has been affected through others' judgment and critiquing of my condition. My view of myself has been changed through others' judgment of something I cannot control or get rid of. Congenital diseases' impact on mental health exceeds just the patient and may affect the family as a whole. According to the National Library of Medicine, a majority of parents or guardians of a child with a congenital disease develop mental health disorders such as anxiety and depression. Many of the reasons for their higher rates of mental health illnesses have to do with their responsibility of caring for their child, as well as having feelings of guilt. Across many studies, it has been found that mothers of a child with a congenital disease typically experience a greater emotional and mental burden than fathers. Congenital diseases may also impact a family financially if their child requires specific medical equipment or care. This may be another factor that impacts the mental health of a family. Neurological changes, depression, anxiety, bullying, stigma, body image issues, and financial worries. These are just a few of the many things that affect the mental health of an individual with a congenital disease. We all experience pain in our lives. It could be as simple as receiving a shot, having your blood drawn, getting a paper cut, or battling a temporary illness. But what people fail to understand is the profound and lasting impact of dealing with a condition from the moment you are born. This is the kind of pain that is not physical and does not go away. A congenital disease is so much more than just a condition. It's the blueprint for how you live and the mental challenges you will face. Thank you.